would your advice be to someone that thinks that they have ADHD or their child or loved one has it?
Well, I think one of the things you can do is actually read as much as you can. I would go to the website CADDAC, CADDAC.ca. CADDAC is an organization that advocates for parents and individuals with the disorder. So CADDAC is the one thing. If you go online, I would go to CADDAC and do that. We have rating scales, and the one that we use in primary care all the time for kids and teens is the SNAP 426, which will give you ADHD and oppositional defiant disorder. It's designed for both the parents and teacher. Most of the time you get an accurate assessment, but sometimes teachers feel threatened and they will sanitize the SNAP 426, thinking that it reflects their teaching ability. And so what's important in that situation, the narrative, the history is so key. In adults and older teens, we use the ASRS, the Adult Self-Reporting Rating Scale, and that is very good too. So those are screeners, and so you can take those screeners if you like. They don't take very long to fill out, and go to your family doctor. But the most important thing is to actually present and talking about your impairments. Okay. And so in order to make the diagnosis, we have to talk, that has to be backgrounded by that narrative of an impairing diagnosis. And so if you can do that and have it kind of put together you can even write things down and say, look, this is where it's at. Because when we make the diagnosis of ADHD, we want to look at three things. I tell parents this all the time. Are you the ADHD duck? Okay. If you quack like a duck, are you a duck? Maybe. Okay. If you walk like a duck and quack like a duck, are you a duck? Well, the DSM-5 says that you are a duck. Okay. And if you look like a duck, walk like a duck, and quack like a duck, you're sure as heck not a turkey. Okay. So what does all that mean? Okay. Looking like a duck, okay, is family history. We know that 60 to 90% of individuals with the disorder inherit the disorder. Okay. But that's not part of the diagnostic criteria for the disorder. So what we look at when an individual comes into our office is the cross-sectional history, being quacking like a duck. So if you're quacking like a duck, you may have a significant PDF file, okay? But other things can cause it too, like an anxiety disorder, depression, a number of things. So, but at least you're in the game by saying, okay, it sounds like it's ADHD. The screening tools that we're using, the ASRS and the SNAP 426, will tell us that you're quacking like a duck. But what we have to do is make sure that you walk like a duck through the lifespan, that you've actually been experiencing these symptoms of impairment with the outcomes of impairment with these ADHD symptoms for more than 6 months, not explained by any other psychiatric disorder. So that's what I mean by walking like a duck, is the metamorphosis of the disorder through childhood, adolescence, and into adulthood, no matter where you are throughout the lifespan. So I think it's important that when you go in and see your family doctor and have them entertain this diagnosis, to say, look, I think I am a duck here. I'm quacking like a duck, and this is what's happening in my life right now. But I've walked like a duck from childhood into adolescence into adulthood. And that's what we look for in making the diagnosis. But the clincher is, you know what, I really look like a duck, okay? Because my father was a duck for sure. And, or my brother was a duck, or, and that type of thing. So actually when I use the duck analogy, patients really get it. And it's with no disrespect towards ducks, okay? And no disrespect towards the patient, because you don't have the big beak, but but that's they get it, okay? They just really get it.